Welcome to Lesson 1. In this lesson, we'll delve into the world of glucose and insulin. Let's get started. Glucose is a simple sugar and the primary fuel source for your body. Your brain, muscles, and organs use glucose for energy. Your liver produces glucose, but it's also found in many foods, especially foods containing carbohydrates, also known as carbs. When you eat carbs, your digestive system breaks them down into glucose, which is then absorbed into the bloodstream and distributed throughout your body. Here's where insulin comes into play. Insulin is released in response to glucose. It acts like a key, allowing glucose to enter your cells for energy. Think of it like this. Your cell is a house with a locked door. Insulin is the key that opens that door to let glucose inside. In a healthy scenario, when insulin arrives at the cell door, it smoothly inserts the key, turns the lock, and the door swings open, allowing glucose to enter and provide energy for the house. However, the lock on the door can become rusty and stubborn over time. Despite insulin's best efforts, the key struggles to fit into the lock and turn it. As a result, the cell door remains closed, preventing glucose from entering. This leads to a buildup of glucose outside the house. This process is called insulin resistance, and it's a big driver of elevated glucose. Insulin resistance typically occurs in muscles, liver, and fat cells. If it persists and the pancreas can't produce enough insulin to overcome it, glucose will continue to rise. Over time, this process increases the risk of developing type 2 diabetes and other health challenges, like heart disease. But don't worry, there's good news. You have the power to take control of your health and improve your glucose-insulin relationship. Hang tight. You'll learn more about how to do this throughout this course. For now, here's a quick summary of what you learned in this lesson. Number 1. Glucose mainly comes from carbohydrates, also known as carbs, in your diet, but your liver also produces it. Number 2. After you eat carbs like rice, bread, or potatoes, your digestive system breaks them down into glucose, which enters your bloodstream. Number 3. When glucose levels rise, the pancreas releases insulin, which acts like a key to unlock cells and allow glucose inside for energy. And number 4. Insulin resistance makes it difficult for glucose to enter cells, resulting in higher glucose levels in the bloodstream and increasing the risk of type 2 diabetes and other health challenges. Okay, that's it for Lesson 1. In the next lesson, you'll learn about the role of inflammation. For now, be sure to flip through the rest of this lesson to check out the helpful visuals and complete the short quiz at the end. Happy learning! Welcome to Lesson 2. In this lesson, you'll learn about inflammation and its potential impact on your glucose and overall health. Let's get started. Inflammation is your body's way of fighting injuries, infections, or other harmful things. It's like a protection system that keeps you safe. Some inflammation is good, especially when you're healing from an injury or fighting off an infection. However, prolonged inflammation, otherwise known as chronic inflammation, can contribute to health challenges like prediabetes and type 2 diabetes. That's because chronic inflammation may make it harder for your cells to respond to insulin, leading to higher glucose in the blood. In other words, over time, chronic inflammation can increase the risk of insulin resistance and elevated glucose. Various factors may contribute to chronic inflammation, including obesity, smoking, high alcohol intake, a sedentary lifestyle, poor gut health, chronic stress, and a diet high in processed foods. Signs of inflammation may include brain fog, fatigue, anxiety and depression, joint pain, bloating, and irritable bowel syndrome. Lowering inflammation is essential for good glucose and your overall well being. You can reduce inflammation by maintaining a healthy weight, losing body fat, staying active, and nourishing your body with whole, nutritious foods. You'll learn more about all of the above throughout this course. But first, here's a quick recap of what you learned in this lesson. Number 1. Inflammation is how your body responds to injuries, infections, or other harmful things. Number 2. Too much inflammation can impact glucose and increase the chances of health challenges like type 2 diabetes and heart disease. Number 3. Inflammation can make cells less responsive to insulin, leading to insulin resistance and high glucose in the blood. And number 4. You can lower inflammation by maintaining a healthy weight, losing body fat, exercising regularly, and eating a nutrient-dense diet. That's it for Lesson 2. In the next lesson, you'll learn about A1C. For now, be sure to flip through the rest of this lesson to check out the helpful visuals and complete the short quiz at the end. Happy learning! Welcome to Lesson 3. In this lesson, you'll learn all about A1C and glycemic variability. Let's dive in. The A1C blood test checks the average amount of glucose in your blood over the past 2 to 3 months. It's like a report card for your glucose levels. The test measures the amount of glucose attached to a protein called hemoglobin. Hemoglobin is found in your red blood cells. By measuring the amount of glucose attached to hemoglobin, the A1C test shows how well your body has managed glucose over time. The higher your glucose levels are, the more glucose will attach to your hemoglobin, resulting in a higher A1C. Knowing your A1C can help determine your risk of developing prediabetes or diabetes. Here's what the different A1C levels mean. Your A1C is considered normal if it's below 5.7%. If your A1C is between 5.7% and 6.4%, it's considered prediabetes. This range is like a yellow traffic light, warning you to make changes before reaching the red light of diabetes. And if your A1C is 6.5% or higher on 2 separate tests, you have diabetes. While the A1C test is helpful, it can't catch all the details. For example, it can't detect glycemic variability. Glycemic variability measures how much and how often your glucose levels go up and down throughout the day. Having high glycemic variability means you have frequent and significant swings in glucose. Think of it like a mountain range with a lot of high peaks and low valleys. A high glycemic variability may lead to energy and mood changes, unstable appetite, and potential long-term health challenges like insulin resistance. On the other hand, low glycemic variability means you have stable and consistent glucose. Think of it like rolling hills or gentle glucose waves. A low glycemic variability is what you want. This means your glucose is stable and consistent. Your CGM data shows your glycemic variability throughout the day, giving you real-time insight into your glucose patterns. With this information, you can make targeted lifestyle changes to improve your overall glucose levels and A1C over time. To find your glycemic variability, visit the Insights tab in your Nutrisense app and look for variability. Hang tight. You'll learn more about how to improve your A1C and glycemic variability throughout the course. But first, here's a quick recap of this lesson. Number 1. The A1C test reflects the average glucose in your blood over the past 2 to 3 months. Number 2. Having a higher A1C indicates higher glucose levels and suggests poor glucose control. Number 3. An A1C above 5.7% means a higher risk of developing diabetes. Number 4. Glycemic variability measures how much and how often your glucose levels fluctuate. And number 5. High glycemic variability means you have a lot of glucose swings throughout the day. Okay, that's it for Lesson 3. In the next lesson, you'll learn more about optimal goals for fasting glucose and A1C. For now, be sure to flip through the rest of this lesson to view the helpful visuals and complete the short quiz at the end. Happy learning! Welcome to Lesson 4. In this lesson, you'll learn more about fasting glucose and A1C. Let's start by going over fasting glucose. Fasting glucose is simply your glucose after not eating or drinking anything, except water, for at least 8 hours. Most people check fasting glucose before breakfast and after a good night's sleep. The American Diabetes Association has 3 categories based on fasting glucose. Category 1 is considered normal. This is when fasting glucose falls between 70 to 99. Category 2 is considered prediabetes. This is when fasting glucose falls between 100 to 125. And Category 3 is considered diabetes. This is when fasting glucose is above 126. Let's circle back to the normal fasting glucose range of 70 to 99. It's important to note that normal isn't always what's optimal. In fact, studies show that as fasting glucose gets closer to 100, your risk of health challenges like type 2 diabetes and heart disease rises. A better fasting glucose target may be between 70 to 90. If that feels out of reach for you right now, no worries. You can start by aiming for a fasting glucose below 100, and as you progress, work towards that optimal range of 70 to 90. Now, let's talk about A1C. As you've learned, an A1C test measures your average glucose over the past 2 to 3 months. The American Diabetes Association says you're in the normal range with an A1C below 5.7%. If it's between 5.7 and 6.4%, you're in the pre-diabetes range, and above 6.5% puts you in the diabetes category. Keep in mind that A1C falls on a spectrum, meaning the higher the A1C, the greater the risk of prediabetes or diabetes. A good target is to aim for an A1C less than 5.7% or even better, below 5.4% for that extra wiggle room. Keep in mind that improving your A1C takes time and consistency, as it reflects your glucose levels over a few months. But don't worry, you'll learn some diet and lifestyle strategies throughout this course to help improve your A1C. Remember to team up with your expert Nutrisense nutritionist to set a fasting glucose and A1C goal that works for you. In the meantime, here's a quick recap of this lesson. Number 1. Fasting glucose measures your glucose level after not eating or drinking anything except water for at least 8 hours. Number 2. Aiming for a fasting glucose between 70 to 90 is great, but starting below 100 is okay if it's more realistic for you at this time. Number 3. An A1C measures your glucose over the past 2 to 3 months. Number 4. Aim for an A1C less than 5.7% or even better, an A1C below 5.4%. And number 5. Improving your A1C takes time and consistency, so stay patient and persistent. Okay, that's it for Lesson 4. In the next lesson, you'll learn about different glucose insights from your CGM data. For now, be sure to flip through the rest of this lesson to view the helpful visuals and complete the short quiz at the end. Happy learning! Welcome to Lesson 5. In this lesson, you'll learn how to use your CGM to gain helpful glucose insights. Let's get started. One key benefit of using a CGM is the ability to monitor your morning average glucose. Morning average glucose is your average glucose during the last 2 hours of your fasting window. You can adjust your fasting window in your Nutrisense app by going to Settings. Then select System and scroll down to the bottom where you'll find Fasting Window. The default fasting window in the app is set from 8 p.m. to 8 a.m., which simply means that you don't eat or drink anything, except water, from 8 p.m. to 8 a.m. Your morning average is a calculation of your average glucose during the last 2 hours of your fasting window. For instance, let's say you fast from 8 p.m. to 8 a.m. Your morning average is your average glucose between 6 a.m. and 8 a.m., which is the last 2 hours of that specific fasting window. A good goal is to aim for a morning average glucose between 70 to 90. Next up is your average glucose. Your CGM shows your average glucose over a short period of time, like 24 hours, or an extended period of time, like 3 or 6 months. A good goal is to aim for an average glucose of less than 105. Remember, your A1C is calculated using your average glucose over 2 to 3 months, so tracking and striving for a healthy average glucose is essential in managing your A1C. Moving on to glycemic variability. As you've learned, glycemic variability refers to your glucose fluctuations. High glycemic variability means that you're experiencing a lot of glucose fluctuations throughout the day. This is associated with an increased risk for prediabetes and type 2 diabetes. On the other hand, a low glycemic variability means your glucose is stable and consistent. Stable and consistent glucose is what you want. Your CGM reveals your glycemic variability throughout the day. You can use this information to identify what's causing your glucose to spike and drop. A good goal is a glycemic variability of less than 20, but less than 14 is even better. Another helpful insight from your CGM is the ability to see your postprandial or post-meal glucose values. Monitoring your post-meal glucose is helpful for a few reasons. Number 1, it gives you immediate feedback on how your body reacts to different foods. You can see which foods cause significant glucose changes and make smarter choices about what you eat. Number 2, it helps you understand how meal timing and portion sizes affect your glucose. And number 3, you can see how long it takes for your glucose to return to normal after a meal. This shows how well your body handles glucose and insulin. Aim to keep your post-meal glucose less than 140 most of the time. Lastly is time in range. Time in range refers to the amount of time your glucose spends within a target range. The optimal glucose range is from 70 to 140, so time in range is the percentage of time your glucose stays within that 70 to 140 range. Aim to keep your time in range greater than 95%. This means your glucose stays within the range of 70 to 140 more than 95% of the time. Aside from the data, one of the biggest advantages of wearing a CGM is its motivational power. Seeing your glucose trends in real time and collaborating with your expert Nutrisense nutritionist can motivate behavior change. Okay, that's all for this lesson. There were a lot of numbers in this lesson. You can learn more by going to the Insights tab in your Nutrisense app. For now, here's a quick recap of what you learned. Number 1. Average glucose is the overall average over a period of time, which is important for managing A1C. Number 2. Glycemic variability reflects glucose fluctuations, and high variability increases the risk of health challenges. Number 3. CGMs show post-meal glucose values, offering immediate feedback on food choices and meal timing. Number 4. Time in range measures the percentage of time glucose stays within a target range. And number 5. CGM data can motivate lifestyle and diet changes by providing real-time glucose insights. If you have any questions regarding your glucose data, please reach out to your Nutrisense nutritionist. They're eager and ready to help you on your glucose and CGM journey. For now, be sure to flip through the rest of this lesson to view the helpful visuals and complete the short quiz at the end. Happy learning! Welcome to Lesson 6, the final lesson in Module 1. This lesson introduces you to the ACT method. The ACT method is a practical and realistic approach to lowering glucose and supporting your long-term health. The A in ACT stands for Adjust Your Lifestyle. The C in ACT stands for Consistency. And the T stands for Tracking Your Progress. By keeping the ACT method in mind, you can make intentional and meaningful changes to your daily routine. Let's go over each element of the ACT method, starting with A. Adjust your lifestyle. Adjusting your lifestyle is the first step in lowering glucose and inflammation. This includes changing your diet and making smart yet sustainable choices to support your body and overall health. 3 key lifestyle adjustments include: Number 1. Balancing your diet with nutritious foods like lean proteins, colorful produce, and healthy fats. Number 2. Exercising to help your body respond better to insulin. And number 3, losing excess weight, specifically body fat, to help reduce inflammation and improve your glucose. Next up is consistency. By establishing healthy habits and making them a part of your daily routine, you set yourself up for long-term success. 3 important aspects of consistency include: Number 1, finding a routine. Creating a daily schedule that includes regular meal times, fasting, exercise, and sufficient rest is essential. Number 2, making sustainable changes. Key word is sustainable. Avoiding quick fixes or fad diets is a priority. Plus, consistency is easier when you enjoy the changes you're making. And number 3, seeking support. Asking for support or help from your loved ones can help you stay motivated and consistent. Lastly is tracking your progress. Tracking your progress allows you to celebrate successes, identify obstacles, and make necessary adjustments to support your health. 3 ways to track your progress include: Number 1, monitoring your glucose. Your CGM can help you understand how certain foods, activities, and other factors impact your glucose. Number 2, tracking your habits. Keeping track of your habits can help you stay accountable and committed to the process. And number 3, assessing other health metrics. In addition to tracking glucose, monitoring your weight and other lab markers can help you track your trends and progress over time. So in summary, the ACT method focuses on adjusting your lifestyle, staying consistent, and tracking your progress over time. By approaching lifestyle changes through the lens of the ACT method, you can take charge of your health and lower your glucose. Throughout this course, you'll learn more about each aspect of the ACT method. Before moving on to Module 2, be sure to flip through the rest of this lesson to view the helpful visuals and complete the short quiz at the end. Happy learning!